I'm Amy Cherry. This local news is a service of Flagler County's Toyota dealer, Beaver Toyota, here to wow ya. Flagler County is expanding testing for COVID-19 in partnership with Advent Health. Tony Magoo reports.
With us this morning is Flagler County Emergency Manager Jonathan Lord with news about coronavirus testing. Jonathan, let's start with Daytona State College.
Testing site at Daytona State College is closed for reconfiguration so that we can reopen on Wednesday with higher capacity and with an enhanced partnership with Advent Health.
I understand you have a change in testing method, too.
Spit testing versus the sticking the swab in your nose and throat, so it's much less invasive.
Daytona State College Palm Coast is located at 3000 Palm Coast Parkway Southeast. Hours for testing will remain 9 a.m. to 1 p.m. on weekdays. Those interested in being tested, though, must register beforehand at Advent Health coronavirustesting.com or by calling 877-847-8747. For Flagler's Morning News, I'm Tony Magoo.
That expanded testing will be the key to reopening the economy in Flagler County. John Arking has that part of the story.
Flagler County peaked and reached the apex of hospitalizations and ICU beds that were needed about a week ago, according to Flagler County Health Officer Bob Snyder. However, he says that doesn't mean the threat is over.
We haven't reached the peak regarding testing capacity and the need to test and to identify the positive cases that are out there that we believe might be greater than originally anticipated given the asymptomatic folks that we're dealing with. So that's the bottom line. Testing is going to continue. That's the name of the game over the next few weeks. And we'll be watching very closely as to the positivity rate, which now is about 10% here in Flagler County. It has been as low as 6%. So I think we're anxious to see this downward trend in the number of positive cases identified. That is what we're going to be looking for next as one indicator for helping us reopen the economy and get businesses back in business.
From the WNZF Newsroom, I'm John Arking.
The kids may be out of school, but there's still a lot of testing going on.
Doctors Scott and Andrea Cleos, who host The Doctor Is In here on WNZF 8:30 Saturday and Sunday mornings, say that those who are tested have COVID-19 symptoms.
They've got the fever, they've got the cough, a combination above, GI distress.
Dr. Scott Cleo said that here, those with symptoms are tested, but in some countries, everybody is tested for COVID-19. He said the virus does not want to kill its host because that would mean the end of the virus and the host.
If it quickly kills its host, it's not a good virus because it doesn't survive and the host doesn't survive.
Cleo said that when this is over, we'll know more than we know now.
We're going to find that the percentage of positive individuals is much higher and the death rate is going to be much lower.
To listen to the interview, download the Flagler radio app. Then go to the Free for All Friday podcast. That's where you'll also find the Doctor Is In podcast. Tomorrow, why we should social distance. From the WNZF Newsroom, I'm Deb Albertson.
Flagler County reopened its beaches 24/7 this week. Dr. Stephen Bickle, Flagler's medical director, weighs in on the decision.
I'm okay with it. I can see it going either way. The bottom line is that from what we know, and it's still kind of sketchy, the infectivity outside is very low, especially compared to inside.
Bickle says those who are exercising outside could have the virus, but are likely asymptomatic, or at the very least pre-symptomatic.
Those are thought to be fairly contagious people. But it's also way easier to maintain social distancing outside. There's fewer contacts per square foot, per area. You're farther apart from people. There's less clustering, except beach congregation kind of things, special settings, or, you're in an outside bar or something. But for the most part, people walking around, there's limited contact.
Bickle points to a study in China in the early days of the pandemic, where he says out of 1,200 people, only 2 persons had contracted the virus, likely from outdoor spread. In Japan, it was 18 times more likely that a person would get the virus indoors than outdoors. The CDC has recommended for several weeks now that everyone wear a cloth mask to prevent further spread of COVID-19. It took Dr. Bickle a while to come around on that, but now he says with certainty.
Yeah. Indoors for sure, and outdoors probably as well. And the idea is, it's just a low-cost way of doing a lot to protect ourselves.
The biggest benefit of wearing a mask is not to protect yourself, but rather to protect others.
Those people are at higher risk. The problem is, since you can't tell, then it's better to have everybody wear a mask. And if you look at it in terms of the impact of that policy on transmission of the virus, It's a really low-cost, relatively high-result policy.
Bickle says a study showed that if 60% of people wore cloth masks all of the time, which are only so effective, the spread factor would drop just below 1.
That alone, that's huge.
And now you're up to date on Flagler's Morning News. I'm Amy Cherry.